Hey, it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about phase one or interceptive case selection. Which cases should you keep in-house? Which cases should you refer out? Which ones are hard? Which ones are easy? Which ones are tricky? And ultimately, this is going to come down to your own comfort level. Initially, when you first get started with phase one or interceptive cases, I recommend that general and pediatric dentists stick with the simpler cases. I know for adults, it's easy to know which cases are simple, right? So I always say for adults, case selection to get started with ortho would be class 1, angles malocclusion, class 1, not class 2, not class 3, class 1, mild to moderate crowding or spacing cases without anterior or posterior cross bites, without periodontal disease. That's my, go-to for getting started with ortho for general and pediatric dentists or general dentists for adults, but for kids, it's totally different, right? So which ones are easy? So anterior cross bites, no problem. Posterior cross bites, no problem. Those are easy. You may not think they're easy, but they're easy. It really comes down to kids a little bit more about what kids do you want to partner with. So don't pick as much the complexity of the case. Pick the child and the parent. You want a parent that's going to listen to you, that's attentive, that shows up for their appointments, that does what they're told. You are looking for a good partner. This is a tripod, right? It's the doctor, it's the patient, which is a kid, and the parent. And everyone needs to work symbiotically, or this is not going to work out, because phase one is so much about compliance and about good attitudes and having a really positive patient who's going to be psyched. The patient needs to be psyched to do treatment. So the most effective phase one patients are that kind of patient where the parents are pumped, the kid is pumped, they're super excited to get their appliance, and wear it to school, even if that means they talk a little bit funny for a little while, but you let them personalize their appliance and get glitter or colors or get their team colors or a decal, and they're so psyched to show their friends. You can see it in their eyes. If the patient doesn't look happy about this, boom, refer that patient out, okay? That is not one that you want to work with, to be honest. It's going to be a battle. Every single day is going to be a battle. So anyways, what else is easy? Anterior cross bites, posterior cross bites, a little bit of crowding, but a little bit of crowding means you usually need to expand in phase one. So you may need to be comfortable with expansion, which by the way is not hard. Class 2 growth, a little overjet, no problem. That's pretty easy. Class 3s can be a little bit tricky. I'm not saying you can't do them, because you can, but that would be more like an advanced situation. You're not there yet. Get a bunch of class 1s and class 2s under your cross bites under your belt first, and then go with the class 3s. And then anything else funky, pathologies, other weird things later, impacted teeth, all that. So hopefully that was helpful. All right, thank you.